Hello, good afternoon, and welcome everybody. My name is Tamsin Rose, and I am the great pleasure of being the moderator for our session this afternoon called Building Back for Rare. And I'd like to welcome those of you who are joining us online, as well as those of you who are here on site with us. What are we here to discuss? We're talking about this opportunity to elevate rare disease as an international policy priority. Now, the world has not finished yet with COVID-19, but we do know that it's an opportunity to reset our thinking about health systems. There have been a number of radical changes over the last 18 months, and part of it is an opportunity to understand how we do things better, more efficiently, how do we collaborate better, how we bring science faster into the realm of working with patients. And all of these are important for rare diseases. And over the next hour and a half, we'll be discussing what we can do to make sure that rare disease remains a policy priority, even though the world is rethinking about the pandemic. And I'm going to introduce each of my panel members briefly and allow them to say something about themselves. So let me start by inviting Bill Sibold to introduce himself. Bill, you're the Executive Vice President for the United States of America, for Sanofi Genzyme, I should say. And we also have Durand Riga, who is a well-known rare disease advocate and the chair of Rare Diseases International. We have Jan Lecam, who is the CEO of Eurordis and helped to co-found that, which is looking at rare disease patients in Europe. We have Matt Bellegarde, who is the APEC Rare Diseases Network chair, joining us remotely. And also remotely, we have Asad Hafar, who's from the World Federation of Hemophilia. He's the Medical and Humanitarian Aid Director for Canada. So we have a very distinguished panel who's going to share experience in a truly global fashion. But let me start by Bill. Building Back for Rare, why is that so important?
Well, thank you, Tamsin, and thank you for having me here today. It's a pleasure to be in an auditorium live after COVID. So it's just wonderful to have an opportunity to sit here with these distinguished panel members. I'm Bill Sibold. I head up the global Sanofi Genzyme business, which is Sanofi, their specialty care division. And I've been in the industry now for 30 years. And I often say that this is the greatest industry in the world to be in, and it is, because it helps people all over the world. And if we do our job right, we provide hope where there's been no hope before, especially in things like rare diseases, which is often these diseases which are forgotten and nobody's paying attention. We've been doing that for 30 years at this company, and I really believe it's an important topic to have a stakeholder group to really talk about the long-term sustainability. And when we think about one of the key important attributes that we should talk about today is this whole notion of public-private partnership. So it's a pleasure to be here, and I look forward to talking with all of you.
Thank you very much. Durand.
Hello, and thank you so very much. First, to the World Health Summit for allowing us to actually have this talk here, and certainly really delight for me as well to be here with my co-panelists. As a global movement, rare diseases, when we say build back better, I think this is an understatement, because rare is at that amazing, I know we use the word flex point a lot, but this is really where rare is. With the science, the patient advocacy, the recognition in terms of health systems, policy has all reached a point where we believe rare diseases is actually coming into its own and really being able to deliver for patients. So for me, it's not just a matter of building back better, it's how do we actually use this and use the change in terms of what has to be done, certainly in the health systems, to be able to harness the science that's taking place that Bill talked about, to be able to work in those kinds of partnerships, to be on that trajectory. I think we're at an amazing point. And what you're going to see in terms of rare diseases, I think, is it's going to actually become one of the drivers in terms of health system transformation, one of the drivers in terms of change. And certainly what we also know is that it will be a great opportunity for patients who for so long have been left in the margins, have for so long felt left behind, taking a lead. So I think rare is not just going to be built back better, it's going to actually be able to help the rest of diseases and the health system to actually excel in this next period.
Thank you very much. Jan, do you share that optimism?
I don't know, for Europe and US and some countries, it's about building back, but for most of the world, and that's the World Health Summit, it's about just building for rare diseases. And I think rare diseases are kind of a stress test for healthcare system at the moment in all member states, but also at global health policy level. If we're serious about leaving no one behind, we should have an adequate answer to the needs of the people living with rare disease. And I think that's the challenge in front of us after COVID, while there is so much opportunities, as was said by you and the panelists, from science, technology, either in the biomedical or the digital area.
Thank you. Matt, let me bring you in. What's your view? We've heard it's a flex point. We heard it's a stress test for our systems. Matt, what's your view?
Look, thank you so much, Tamsin. And so I'm the chair of the APEC, Asia Pacific Economic Cooperation, LSIF, Life Science Innovation Forum, Rare Disease Network. And really, this is an exciting time, and I'm really delighted to be a part of this panel. And it's good to see Jan and Durand again. It's about, from our perspective, from APEC, it's about strengthening collaboration at scale and listening very carefully to the needs of the individuals living with a rare disease and their families and their carers. And the only way that that can be achieved is through strong partnerships and collaborations. What was really exciting about what we've established at the Rare Disease Network, the Economist recently described it as a very strong, the largest, strongest public-private entity and network for rare diseases. And so I think really that's so important. And APEC has the strength of 21 economies representing 40% of the global population, 50% of global trade, and 60% of the global GDP. And so when we think about rare diseases in the APEC economies, we're talking 200 million individuals living with one of 7,000 rare diseases. So we do have the strength and power as a collective to work together with our colleagues and partners in Europe.
Thank you very much. Hassan, let me bring you in on this one.
Thank you very much. I would like to start really by a phrase that I heard it a lot from the people with hemophilia. They always say, there is always light at the end of the tunnel. I'm going to take this phrase and I'm going to just put it in my words, and I'm going to say, I see a light at the end of the tunnel. I've been with the World Federation so far 21 years, working for developing hemophilia care in the countries and at the same time managing our humanitarian aid donations. We've witnessed a lot of time up and down in relation to treatment of bleeding disorders. Recently, with this pandemic, we had even more and more challenges. But I can see now that we can recuperate, and I can see that we're gonna, if not bring back rare, but we are gonna continue serving these people who really deserve the services that we are providing. Bill talked about a very important thing, which is the partnership between public and private. And I'm proud to say that Sanofi Genzyme is our biggest partner in our humanitarian aid program. And we really value this. And the things that we are getting from different partners in this is helping tens of thousands of people with hemophilia around the world. So I would say that although with the pandemic, although with the difficult times we had in the last 2 years, I'm looking for a brighter future for the health and well-being for patients with hemophilia.
Thanks very much, Asad. So now let's talk a little bit about COVID and its particular impact on the rare disease patient community. Now, it was a transformation event, and we saw rapid changes. Much healthcare shifted online very quickly. So we also had rollout of genetic databases that we used to track things. We had greater surveillance, public health that was engaged. So there are many things that came about as a result of COVID that perhaps we should think about how we keep them. Should they become the new norm? So let me ask you now, from the point of view of the rare disease community, what transformations did you see that we should keep as the norm, and where has it revealed some gaps that we need to deal with? So Durand, can I ask you to kick us off on that one?
Thank you very much. And definitely the way you put it is exactly how we would see it in the patient community. There are certainly a lot of things that happened that I think are actually accelerated. For instance, the ability to use and to develop electronic health records and to make sure that we're able to have patients' information stored, to be able to use that. Certainly telehealth, I think, as we knew around the globe, actually took a big leap forward, and to be able to do even remote diagnostics, even diagnostics in which we had to do, mobility kinds of testing. I think there's a lot of adaptation. So kudos to the healthcare professionals who were able to do that. Certainly companies, we saw them step forward with some very creative ways of continuing clinical trials, being able to do off-site clinical trials, which were actually going to be able to continue to do to get more people that are in more remote areas to be involved. So those are the kind of things that are very, very exciting. And I will say within the rare diseases in terms of research and development, I didn't think we felt anybody missed a beat. We saw things continuing on. We did not see things kind of slow down. I mean, companies that were involved in doing some of the things for the pandemic were definitely there, but nobody stopped for us. I will say, though, is that there are a lot of things that we are still concerned about, and maybe we'll talk a little bit more about that, but certainly for patients with rare diseases who are already struggling in terms of getting access. Definitely people miss being able to get in to see their specialists, being able to get the rehab that they needed, being able to even get testing and the monitoring in order to continue their medications. This was a huge challenge, both from the point of view of the patients and from the system. So I do think that as the rare diseases community, and we've been having these discussions, we recognize that, we were all said during that first, year, okay, it is going to be over. In a few months, we'll be back to normal. We can get back in there, everybody can get tested, everybody can do everything. No, it didn't happen. And then we have the second wave, and we have the third wave, and we have the fourth wave. Maybe some people are looking at the fifth wave. And we realize we're going to be living with this. So what we're calling for is really a readjustment, because we are losing not just rare diseases, but other chronic diseases, and we're letting them fall through the cracks. And I think, patients have been very patient up to now, but really we are beginning to assert ourselves and to recognize that. I mean, as some of the patients say to me, I'm not going to die from COVID, but I'm going to die from the fact that I'm not getting access to the diagnostics, to the testing, and to the treatments that I need or my child needs. So we need to do that readjustment and to recognize that those of us living with chronic diseases, with rare diseases, really need to also be, treated in that health system. And if it means an expansion of the health system, I think that's a good thing. But it means that leaving no one behind means that we definitely have to be there. And I think the good news is that patient advocacy has developed to the point where people feel that they are able to not only stand up and say, yes, we need to be counted, but to contribute to the solutions. And that, I think, has really been the biggest change, is we've learned how to do many more things in order to come up with. I was in a great mental health session just earlier today, and really, we recognize the impact of mental health and the challenges on patients and families, but we also saw was coming out of the community some powerful solutions for how do we actually address those issues and how do we change the system to be more responsive. So we're getting better too.
Excellent, thank you. Matt, do you want to bring in your perspective from your part of the world? You explained just how many people are touched in the APEC region. What was the impact that you thought, here, this is something good we can keep, and where are the gaps that we need to pick up on?
Thank you, Tamsin. And certainly, the APEC Rare Disease Network is a cooperation between governments, academia, clinical experts, industry, and patients. And I guess the Rare Disease Network and the collective recognized early on that the pandemic was going to impact patients acutely and uniquely. But we also knew that our spiritual leader, Durand, and the RDI and Eurordis and others would have a good handle on measuring that impact. So what did we do? And I guess this is that really important public-private partnership that comes into play here. We surveyed the policymakers themselves to find out that the pandemic was actually slowing their work and diverting resources. But interestingly enough, less than we expected. And so the APEC Rare Disease Network created a suite of recommendations for governments based on these findings. And for example, economies where rare disease policy is managed in a dedicated department or division had less interruption to their work on rare diseases than economies where rare disease policy is done in an ad hoc and in an informal way. And as Durand mentioned, care, I guess, should not be based on postcode. And so the links between rare diseases and COVID are so intertwined. Not all health systems, hospitals, academic organizations are equal, and they certainly are not at the same point in their digital innovation journey. So yes, we saw the sharing of data, but what we're experiencing, I guess, is that there are significant blockers that still exist in getting access to data. Sharing of health data, policies and procedures with jurisdictions are often just too complicated to understand. Of course, as we know, the virtual consultations and telehealth has become the norm. Understanding the natural progression of disease and infection in COVID-19 involving multiple clinics, specialties, and it's really akin to what we're experiencing with rare diseases. So, what we have found, though, in the last year and a half is that COVID-19 has really sort of provided that sharper focus and a general willingness to address these issues collaboratively. And that will benefit the plight of the rare disease community. And we're finding, certainly from a digital perspective, the digital, the registry work for rare diseases is certainly able to be leveraged to support COVID-19. And the running hypothesis that the rare disease, I'll just finish here, Tamsin, the Rare Disease Network has is that rare diseases shine a spotlight on gaps and barriers in our health system. If we solve these issues for rare diseases, we then improve the health system as a whole. So you can sort of get to see that, I guess there are some positives in the fact that we can support COVID-19 with the solutions and approaches that we're taking, and then COVID-19 can accelerate what we need. But the whole community is known for quite some time that needs to be navigated.
Thank you. Jan, let me bring you in on this one. The impact of COVID-19, the positive aspects where you saw acceleration and movement in areas, and then the gaps, that Durand has mentioned some of them, the lack of access, the inability to have diagnostics and monitoring. What's your perspective?
Let me go back to our real life experience of last year. We had a survey in May 2020, so just 2-3 months after, and 7,000 respondents of people affected by rare disease across Europe answered. 80% of them experience a disruption in their care. And the vast majority also explained the social isolation. And we know that this has continued. Out of this 80%, 3 people out of 10 felt that the impact was severe for them. And 1 out of 10 in the 7,000 felt that it was threatening their life or reducing their life expectations, like organ transplant canceled or deferred several times, enzyme replacement therapies or infusion being suspended for some time, and then trying to find new options, etc. So all these kind of issues, chemotherapies also interruptions, not able to go to a hospital and needed to find a solution in the community. So that's the impact. Now, it's a resilient society, community, I would say. The people with rare disease are resilient to address their issues, so they have adapted. But there is 2 positives that I would like to take. One is that from that same survey, we found that 98% of the people were happy with their electronic prescription. What a surprise. Then 90% of them were happy with their medical consultation being online, and 90% also were happy with their therapeutic education or self-help online. So the system has adjusted. There is new experience, will not go back to the previous situation. And there is a readiness for an uptake of all the digital transformation, I would say, from the patient side, and I hope from the healthcare system, hospital, and doctors in the community. The second positive is the decision-making process. We've seen review of marketing authorization fast-tracked. The ability to go faster, that's something we should not go back to the previous situation. The pool procurement, when it is meaningful to do it, should also be maintained as a relevant approach for Europe. The closer collaboration between the public authorities and the private companies on how to address the challenges is also something to nurture and to continue. And I hope we will see the payers becoming buyers and maybe tomorrow investors, active rather than passive.
Excellent, thank you very much. Let me now bring in Asad to get the perspective from the haemophilia community. We've heard of the positives and the negatives. The shift to digital was found to be very satisfactory, and people were happy with that. It gave them more possibilities and more a sense of agency and control, but huge disruptions to their care to the point where the rare disease patients felt it threatened their lives or their life expectancy. So huge divergence there. What's your perspective? What did you hear from your community?
Well, in fact, thank you very much. That's really very, very important aspects to cover. We heard a lot. I'm going to take it from two aspects here. First of all, the countries and the patients themselves, because as you know, in countries, many of the hospitals, they were transformed into some kind of quarantine facilities, and they were closed, which meant that many of the treatment centers that hemophilia patients used to go for seeking treatment, it was closed. That meant that they cannot go to these centers anymore. What made things also more difficult is the lockdown of the countries. So even going to a different center was going to be also a little bit challenging for them. At the same time, even with the countries, and that's we witnessed from our annual global survey that we ask our member countries to fill, with countries that they provide the treatment products and care for their patients, we witnessed a decline in the amount of clotting factor concentrates purchased or provided by health authorities, because many of these health authorities try to move the resources and put more resources, for example, in the pandemic and into the buying or purchasing the vaccines. So this really reflected in a very negative way on the hemophilia community. At the same time, from our perspective in the WFH, where we channel our donations, because of the cancellation of many, let's say, because we usually send this by air cargo, the cancellation and the delay in many flights meant that the prices went rocket high for storage and shipping, and forced us to adopt new strategies and new methods on how we can deliver these treatment products to the countries. So for this, many new, let's say, innovations and positive results, like Jan just mentioned, evolved from the situation. For example, home treatment became much more prominent, and now it is being respected in many countries by providing, let's say, factor concentrates to the patient to keep at home. At the same time, having product at this as home treatment it helped in initiating prophylactic regimens and prophylactic treatment for the patients who are at home. So we shifted from on-demand treatment to prophylactic treatment. And that's, prophylaxis for hemophilia is the standard of care worldwide. Many countries in the past, they did not use it, but now many are forced to use it because of the new circumstances. What was more important is what reflected on training. In the past also, we used to do a lot of training for both patients and health professionals. And we used to do it in person. With the new system, with the pandemic, we had to do a lot virtual, and that reflected on reaching more and more health professionals and more patients. Just comparing the numbers, 2019, for example, with the training that we did, we reached almost about 250 health professionals. In 2020, we reached 1,400, and now in 2021, we are almost in mid of October. We reached more than 1,600 health professionals and treaters trained on how to diagnose and how to manage hemophilia, which is really very, very important. At the same time, in the countries themselves, because of the lockdown and the closing of hospitals, it forced treaters to start building and establishing satellite health facilities. So we have now just a few examples. For example, in Kenya, in the past year, they managed to open new 5 satellite health facilities to treat hemophilia, in addition to the 2 major centers in the past. All this were innovation, positive results of the way that the hemophilia community, both treaters and patients, managed to cope with the pandemic.
Thank you very much. I think you've given some really wonderful examples, members of the panel, about this can-do attitude that someone mentioned, that what the pandemic did is it triggered an openness to new ways of working and collaboration. So Bill, let me ask you, what more can the pharmaceutical industry do to support both the rare disease patients and the health environment more generally in this challenging time, in the spirit of this can-do attitude?
Yeah, well, I think during the pandemic, actually, there's been more of a can-do attitude displayed than probably in the history of the world, I would argue. And the way the industry, I think, can help the most, it's deal with the acute situation first. The production, the discovery, production, and ultimately distribution of a vaccine or a intervention treatment for COVID-19 really is the way to get the world back on track, and also, most importantly, in the discussion today, patients with rare diseases. Now, when you get into a crisis like this, it's remarkable how clear objectives become. And for us, it was very clear that we had to be able to manufacture product and get that product to patients. And sometimes people forget the difficulty in the first piece of manufacturing just by nature of trying to get employees into these manufacturing facilities in a safe way so that we can continue to produce. And the teams just did a remarkable job keeping production over 95% during the pandemic. Now, distribution, and Assad mentioned this in his comment, some very innovative ways of getting life-saving medicines to patients were implemented during the pandemic. For instance, at-home infusions were heavily used, and that's something that I hope that there is a pathway that type of availability remains possible for patients, because it is much easier for them to be able to, within the comfort of their own home, receive treatment rather than trekking, in some cases, many, many kilometers and distances to get an infusion. So those are a couple of ways. Now, I'll just, on the comment of how we came together, it's quite remarkable. This is the industry I'm in is a somewhat competitive industry, but with the pandemic, companies were banding together, working together, sharing information, and very rapidly moving products into the clinic, and in a safe way, running trials and ultimately ending up now with what we have, really, really great solutions for COVID-19. So lots was accomplished. I think that there's a lot more that can be done. And I think that many of the things that we learned in COVID-19 can also be applied to the way we think about, as I had said earlier, these public-private relationships for the rare disease community.
Thank you very much. And let me invite you, the audience at home or in your offices or wherever you're watching this, to ask you the same question. What changes or adaptations were introduced during the COVID-19 pandemic that we should keep? And we've heard about some of this, the can-do attitude, the sharing of data, the speed, the focus, the rollout of digital that allowed much greater reach, much greater involvement. And where did it show us the gaps that we still need to fill? So we're interested in hearing your views and your comments. I have a colleague who will be bringing them in when we've got them. So please share your ideas and your thoughts. So let's now move to potentially the post-pandemic phase, which is we're now going to be looking at our health systems and the conversation which never goes away about health systems, which is financial sustainability and resilience. Let's now just reflect a little bit on how the pandemic has affected that conversation. And I'm going to ask Durand to come in and say, how do we make sure that rare stays a priority when governments are clearly going to want to prepare for the next pandemic, They've got a huge backlog of undelivered care from the last 18 months to deal with. The health workers are going to want a pay rise. There's a lot of other conversations coming in, talking about resilience and sustainability. How do we find space for rare in that, Durand?
I don't know if it's so much just finding space in that. It's a great question. I think it's recognizing that rare is just as important as any other kind of condition that we're talking about. And in fact, I mean, certainly patients living with rare diseases would say that the ability to actually support and sustain rare diseases is no less than what it is that we're doing with COVID. I mean, what COVID taught us, and I think Jan talked a bit about it, is in fact how systems can rise to the occasion when it's necessary, how resources can actually be found when it's necessary, and how that can actually turn back into economic benefits. I think what's happened in the past is that we've been able to just ignore those with rare diseases because they are, in fact, somewhat small individually, but collectively a lot. There's a new study that just came out in the US that looked at the economic impact of undiagnosed rare diseases, but also the economic impact of people living with rare diseases, not just on the patients and the families, but on the systems itself. So I think for us, it's being able to elevate that level of, you know, Jan talked about data. How do we get that data out there? How do we make it so that it's really apparent? I mean, what we've said over and over in rare diseases, just because you're not treating it, just because you're not diagnosing it, just because you're not putting in the research and development, don't believe it isn't costing. It's costing us. We just haven't counted it. We just haven't made it apparent. So that goes back to us a bit as well. How do we put it out there as clearly? I mean, nobody had to do it for COVID because I think everybody felt that they could be affected by COVID, and the impact was, you know, sort of widespread. But I would say that quite frankly, and, you know, Matt talked a bit about numbers, the number of people affected by rare diseases, the absolute devastation that rare diseases can have, not just on that patient, but on the health system, on the economy itself. I think that just needs to be counted in a way that is absolutely, you know, evident. So for us, I think the lesson is how do we put ourselves into that space to be able to collect the information, to be able to share that information, and also then to make sure that the resources are there to address it the same. You know, there's no, I mean, we've heard, you know, I remember one time a health minister said, you know, oh my gosh, we're spending 20% of our, you know, public healthcare, public dollars on healthcare. And then it was like we're spending 30% on it. I mean, my question is, what is the right amount? There is no God-given amount that says it's the right amount. We spend what we need to in order to resolve the problem. And I think WHO, the UN, has also made it very clear. You cannot have sustainable development. You cannot have advancement in an economy unless you're actually taking care of the people. And we've even heard it said, you cannot say that you're taking care of people unless you're taking care of those with rare diseases. So it's all part of the same. We just need to make sure that we've got the information out there and that we're sharing that information. The other thing I think, as others have said, is that rare disease community, and not just the patients, but the healthcare providers, the industry, those who are working in the policy area, have really stepped forward in order to take on that leading role. And I love Matt's comment as well, because it's not trivial. And that is what we're learning and advancing in terms of rare diseases actually has an impact everywhere. A lot of what we've learned in terms of vaccines, mRNA, you know, technology came initially out of rare diseases. So a lot of what we're experiencing in terms of being able to target, identify, and to really be able to focus on a patient that has a specific genetic mutation has a lot of impact. How we're going to treat cancer, how we're going to treat other chronic diseases, but probably down the road, recognizing that it's also going to be how we're going to be treating COVID, which is not the same for everybody, which is not the same strain for everybody. So taking a more focused view is something that, again, the rare diseases can actually help us to better understand.
Thank you, Durand. And you make a very compelling case about how focusing on rare gives benefits for the whole of the health system. I wonder if I can bring in Matt at this point, because Matt, you said earlier that, you know, across the APEC region, the countries that had a dedicated rare disease team seemed to be able to do better in terms of continuity and support than the ones that had a very fragmented approach. So I wonder if you can pick up on some of the elements that Durand has mentioned about this perceived trade-off of, well, we've now had to spend a lot of money on health and that's too much. Well, and Durand said, well, how much is too much? Is there a right number, especially when you consider that the health impact and the economic impact exists for rare disease patients? It's just that it's not necessarily being counted. So Matt, what's your view on this?
Thank you, Tamsin, and certainly Durand has articulated that very well. But this is exactly where the Rare Disease Network comes into its own. It is embedded within the Life Science Innovation Forum. The Life Science Innovation Forum is really the heartbeat of a healthy population, a healthy economy. A healthy economy means you can have a healthy population. It's that nexus there. And the LSIF, of course, is embedded within APEC, which is intergovernmental. So we have got, and this is the exciting part, we have got rare diseases front and center into APEC. The 21 Prime Minister, presidential level, ministers of health have endorsed that action plan. The action plan, 70 recommendations, 30 targets across 10 themes, pillars. So in some respects, that's it is front and center. And in many respects, the Life Science Innovation Forum can take rare diseases with it as it sort of reflects on those, as you mentioned, Tamsin, the broader financial sustainability issues. And so the LSIF is looking to benchmark an economic case for health equity in a COVID-19 world. Just to put that into context, it's looking at understanding those vulnerabilities in the health system that transcend any condition, any disease, prioritizing healthcare financing as part of long-term investments in healthy populations, ensuring strong like a health reserve for economic and health challenges in a post-COVID era. That ecosystem for research and development, the response to COVID-19 pandemic, regulatory and supply chain flexibilities for stronger international cooperation, of course, leveraging the digital, building that sort of resilience in the health system. So the LSIF is really just, I guess, engaged at that level. And, the rare disease world in the APEC context comes with it. And of course, APEC is not, the Rare Disease Network is not an exclusive club. We are engaged, and we're very excited to be able to interact with other countries to share our knowledge. But what we've done in that action plan is to really develop small, discrete actions, hence the term action plan, that governments can take over time to build the systems that allow appropriately managing rare diseases. And so each economy, each government will focus on different elements of their action plan, the action steps that are customized and tailored to their stage of growth or their state priorities in their health system, but then the opportunity is to harmonize across them. So that's the sort of take from an APEC context, Tamsin.
Thank you. Jan, maybe I can bring you in this just to add an additional comment, because at the beginning of the pandemic, you had the IMF and the World Bank and others who were saying the world cannot afford to not spend the money now on health. So it was a clear priority set by global international agencies, said that we can't afford not to deal with this. And yet Durand has said, here's the challenge. There is a cost for rare disease patients and their family. There is a cost for the economy, there's a cost for society. Just because it's not visible and quantified doesn't mean it isn't there. So what messages could we put forward to the big top table of finance who are going to be talking about, how much we should be spending on health, to make the case that we need to quantify exactly what Durand said, the cost and the impact to rare diseases, so it becomes as clear to policymakers that we can't afford not to do something about rare, in the same way it was evident to them that they needed to open their wallets significantly for the pandemic.
Being able to afford or not afford is a very short-term view. Not that I deny the importance of money and what we can afford. It's true for anyone to buy a house or to go on a holiday, or to decide to go to the restaurant or not being able to. But it's a kind of choice of society. And the international community, through all the member states and United Nations, have chosen on their agenda for 2030 to have the Sustainable Development Goals and their motto is leaving no one behind. So the question is that, are we real about it? Do we really want to leave no one behind? Now, you're going to tell me, okay, but at which cost? But that's not the first thing we faced with. The first thing we faced with is that 300 million people are ignored in most of the world. And there is no worse violence than that indifference. There is no problem if society is turning the eyes away from the problem. But if you put yourself in the situation of a mother, of a father, of a child affected, that only the family cares about the issue, that they cannot go to school, they cannot evolve in society, they cannot be included in society, they cannot start to create economy around them, they cannot start to be taxpayers. This is the real finance. This is the real finance, is that does every life worth the life of the others? And I know that some people will say, no, this life, which is really of poor quality, doesn't worth the same thing. But that's the bottom line. Because the next question is, for you, Tamsin, when you will be 40 years from now in a home, what's the worst of your life? Am I ready to finance for it? So it's all about how do we address the cumulative vulnerabilities, and how as a society we're ready to have the solidarity with the people who are accumulating these vulnerabilities. And yes, it may come with a cost for a fragment of the population at a certain point because there is an expensive treatment, but that's a fragment, and that treatment cost will go down. And we need to look not only at that fragment, but at the overall population of people with rare diseases and on the overall population. This is the real economy, and as Durand said, is investment in people. Not only health, but education also. So if we are true about it, I wouldn't say there is no cost, because then when it comes to individual cost, it's something different. But as society, we should definitely invest.
Thank you. Bill, let me bring you in on this. What's your perspective, and how Sanofi Genzyme working to transform the rare disease environment?
Well, just before that, going back to this economic cost that Durand mentioned, the survey, or not the survey, the study that was done in the US by the Every Life Foundation. This was looking at 2019, what the economic burden was in the United States with a subset of rare diseases. So it was 379 diseases, and which affected about 15.5 million people in the US. The 2019 cost was $966 billion, almost $1 trillion. 43% of it was direct medical costs, and 57% was indirect. That is astounding. And when you begin to look at other chronic diseases, as Jan had mentioned, that this is a highly fragmented area, rare disease, but when you put it together, 300 million people worldwide, the economic burden is tremendous, and we have to have those numbers in mind. Now, as I think from a company perspective, there's a couple things that we have to do. First, and it's kind of the easy one that people think about, it's not so easy, but it's one that you will default to, is create new innovation. There's 7,000 diseases out there. Not all of them have a solution, and that falls squarely on the shoulders of great relationships between academic centers and industry as well. And I think that there's great progress being made, because if you just look at the numbers over the last 30 years, the number of therapies available has increased significantly. The other piece which we don't talk about so much, but what we are very proud of as a company, is from the very start of our first therapy in 1991, we realized that not every patient in the world is going to have access quickly, and not every system can support the payment for products, et cetera, initially. It takes time. And we created the humanitarian program where from 1991, we have been helping patients, rare disease patients all over the world, regardless of their ability to pay. And to date, it's been over 3,300 patients. There's about 1,000 currently that we are tracking in 70 countries around the world. And it's a way of thinking that we can't solve the problem on our own. We can't make sure that every single patient has access in a timely way. But this is something that we have taken very seriously and made a core part of really the culture and essence of the company. And it's something which, I can tell you it is one of the most gratifying parts of my job when I hear stories about futures that have been possible because patients have had access to life-saving therapies and they've gone on to have their own careers, their own children, their own family. And it is through efforts like that that I think it is one of the pieces of the very complicated puzzle to making sure that patients do have access around the world. We also have done the same thing with our hemophilia humanitarian program that Assad had mentioned a little bit earlier, and he may comment on later. But I think it's important. We as an industry, we as a company play an important role, and it has to be a holistic view. By that I mean, you cannot say that we don't have a responsibility in providing to those who cannot afford on their own.
Thank you, Bill. Assad, let's bring you in on this because Bill just mentioned the humanitarian program. Can you tell us a little bit more about the role and impact of this program and how that provides sustainable access to innovative medicines across the world?
Yeah, thank you very much. So I'm going to start by just mentioning three small facts, brief facts that apply to hemophilia, but also for most rare diseases. Hemophilia is a rare disease, which means that it is not in the highest priorities, or it might not be at all in the scale of priorities for most of health authorities, particularly in developing countries. The second is, although it's a rare disease, but it can either lead to early deaths. Most of the people who are not treated, they will die early, and they are not going to go from childhood to adulthood. And for those who may go from childhood to adulthood, they are going to be disabled. And the third thing, the third fact, which is very important, is with proper treatment, the specific treatment for hemophilia for, let's say, with clotting factor concentrates, or with other specific treatment for rare diseases, people can live normal life. And that's three facts, and particularly the third one, we need to make sure that health authorities understand this. Now, with the humanitarian aid program and with the humanitarian aid donations, we can really show health authorities the value of treating with clotting factor concentrates. They're going to see a new generation of people with hemophilia having normal life, attending school, going to and work, have good employment, and they can marry and have their own life. So this is a really important aspect to show them that proper treatment is going to lead to a healthy person who is going to be a productive person in the society. The second thing, which is going to help in the sustainability, is giving these products to hemophilia society and treatment facilities is going to provide them with a tool for advocacy. And I think Durand just mentioned advocacy as an important tool for the future to advocate for proper treatment for rare diseases. So when we give proper tools to hemophilia societies, we are strengthening them with new methods of how to better advocate for proper care with health authorities. And that's going to lead more engagement from health authorities into care and provision of treatment product. And the third important aspect also is it's going to enable these hemophilia societies to make alliances with similar societies. And we have witnessed a lot of these, particularly in Africa and Southeast Asia, alliances between hemophilia societies and, let's say, sickle cell disease in Africa, or with thalassemia societies in the Middle East and the Indian subcontinent. These alliances, they work together and they push more for the advocacy for better care with these health authorities. Taking this into consideration, we witnessed a lot of successful examples around this. Following a lot of advocacy, a lot of donations, for example, just this year, we had the first purchase of treatment products of one of the countries in the Indian subcontinent, Nepal. They never purchased or they never provided any treatment products to their their people. Now they started to provide. The same came with Bangladesh, for example. India a few years ago was the case. I remember I was in Senegal, in Dakar, a few years back, where the person from the representative in a meeting that we organized from the Ministry of Health handed the president of the Senegal Hemophilia Societies the order of the first provision for factor concentrates in that country. It was really an overwhelming moment for the hemophilia community who were present in that celebration, because it was the top of, let's say, efforts advocacy for more than 10 years, and at least they started to see that. And that brings me to what I said at the beginning of this. I see a light at the end of the tunnel. It is there, and we are moving in the right direction.
Thank you for that. And I think many of you have highlighted the importance of collaboration and connection. We just heard fantastic examples of how advocacy being brought together, bringing different patient groups, can create the political pressure for change. So, and one of the other areas that came up quite a lot is, rare diseases are small numbers in a country, but when you add it up globally, there's a lot of people. So the power of numbers works at global level. So why do we need a global framework for rare disease? What will it deliver that we can't already achieve in terms of our efforts? And Durand, let me start by inviting you to set out a vision.
So let me go a half bit sideways, if you don't mind, Tamsin, first. I'm actually sitting here in this wonderful World Health Summit in a very polished kind of environment. I'm actually trying to control myself, because as I'm listening to some of this, part of me gets very sad, and part of me actually gets quite angry. Because I think we're not, and Jan kind of used the most important word, I think, it's an investment. When we send children to school, we don't think, oh my gosh, how much am I spending on education? When we train people in jobs, we don't say, oh my gosh, how much is this costing me? This is a waste of money. This is too expensive to train people. No, it's an investment. And the same with healthcare, it's an investment. And this is why companies have come into this space, right? Because they're investing in terms of products that are going to definitely improve the lives of people, but also bring a return on investment. And I don't just mean profits to the company. I mean, it's a return on investment so that we can actually have more innovation and do more research. That's the model we should be thinking about in terms of our public health and our health systems, right? People living with conditions are actually an investment opportunity. We all have conditions, whether it's cancer, whether it's arthritis, whether it's cardiovascular disease. Many of us have multiple conditions. And when we think about, investing in the health of people, we are talking about treating them so they can actually go back to be members of society, raise families, as Jan is talking about. We need to shift that and really think about how do we invest in people? And investing in rare diseases is such an important component of it. And yes, as you say, globally. The other thing that actually is making me quite angsty here is that I realize how stupid we are. When people talk about advocacy, and I think I mentioned it, and I was talking to somebody about how do we actually get access to new products, the innovations are coming out. And says, my gosh, do you do that over and over again? Every time a new product goes out, you have to get people round up. You have to make the case for why it's cost effective. You have to find a system in terms of being delivered. I say, yes. We do it over and over again. It's like hand-to-hand combat instead of being smart about it. I started my advocacy career in hemophilia. I have 2 children born with rare diseases, but that wasn't where I really began. I began with hemophilia. And if we took the lessons that hemophilia taught us at that time and we had applied it as we move forward, we would be in such a different stage right now, recognizing we invest in clean blood. We invest in products that are going to have no risk of contamination. We invest, as Assad says, invest in prophylaxis instead of treatment on demand. Think of how that happens. We invest in people to go to, get education. Why are we not doing that, right across the globe? And we invest in it as a global economy. This is what the UN is all about. We have the UN resolution. We have the WHO programs, but we've got to do it smartly. What can we do better? How can we be able to do more? We need to use the lessons. We need to work collaboratively. We need to do things efficiently. I now realize I spend my last 20 years doing the same darn things over and over and over again because the system isn't changing. And unless that system changes, I don't want to spend another 20 years doing this. I really would like for us to get smart and to take the lessons that we've learned and what COVID is teaching us and to be able to say, okay, don't build back better, build back a lot smarter. We need to move forward.
Thank you. Yeah, and I saw you nodding when Durand described the hand-to-hand combat on a case-by-case, trying to get the message through and gather up all the people and make the case, etc. You know, I sense the scars on your back too.
It does. I will echo what Durand says. To be smart for me is to prepare the future by design rather than to leave it to chance or hazard. And if we speak about investment, the first thing is to go from that indifference that I mentioned before to recognition. How do we get there? How do we get to the fact that 193 countries in the world recognize that they do have a problem, people affected by rare disease, and they need to qualify the needs of these people to start wanting even to address them. If not, they just ignore them. And that has been the advocacy strategy, going beyond the product and the specific to address the bigger question with all the limits of the international community, but using the system. And the system here is the United Nations. And we decided to embark in this journey in 2009, then 2015, and here we are. We're very close to get a UN resolution at the General Assembly to address the needs of the 300 million people living with a rare disease. Already the title of the resolution is something. What it does is that it recognizes the problem and then it engaged the UN system within rare disease. So the different agencies and programs like the Development Program, World Bank, will not say anymore, rare disease is not my problem. They are not obliged to do it, but still, it's General Assembly, it's strongly indicative to them. For the member states, it's an invitation to develop strategies to address the needs of their people along certain lines. It's non-binding, but it's already something. And there is a regular reporting into it. So that's a start, particularly that last year or in September 2019, we got rare disease mentioned in the political declaration on universal health coverage. So that means, hey guys, increase the population covered in your coverage, reduce the out-of-pocket money, increases the quality of services. That are the three dimensions that we do need to address your needs. So that's going in the right direction. So the kind of change we expect from it is that a resolution is not going to change the life or save anyone in the following night, but it will provide a tool that anyone can grasp at the member state level or in the regional level, policymakers, central administration, doctors, patients, to use it to develop solutions locally and to mobilize. This is what it is, a leverage for action. But that's a game changer because then the problem has a name, it is qualified, and there is a strategy to address it.
Thank you. So it's an important signal. It's a game changer. It's a recognition. It's a visibility, even if it's then up to member states to voluntarily see how they do it. But if you link that to the fact that rare diseases was specifically mentioned under the universal health coverage for health systems, you've got these two elements there working together. Asad, can I invite you to come in and comment on this? You know, looking at it from a global perspective, why is it so important to get a global policy framework? We've heard messages from Durand saying that she hopes the system learns and we can be smarter about the way and that the system needs to change rather than forcing the advocates to go through it. Jan's told us how much of a game changer the UN resolution can be, and particularly linking it into the universal health coverage. Where are you sitting on this perspective?
I'm going to mention here from also our experience in some of the countries, particularly when we talk about health authorities. We represent here, let's say, international NGOs. Many of the health authorities and ministers of health in many countries listen to WHO and listen to official UN organization. So partnering with these organizations and having them supporting our back is going to give us as international organizations and give the local hemophilia societies in each country the power and the support they need in order to go and advocate for health authorities. So this is really very important. The international coalition and bringing international, the UN, particularly the UN organization into this. We need to partner and find, it's some kind of moving together in one direction. We have to find the common ground where we can bring our interest with the interest of the international UN system in order to make sure these rare diseases people into the equation. And I would like to mention also one aspect here, which I think was mentioned today. We are talking about rare disease. We need to bring and be innovative in making these rare diseases, let's say, less rare. And how we can do this, it's by proper diagnosis. I'm going to take, for example, the example in Africa. In Africa, maybe less than 3% of the expected number of people with hemophilia are identified and diagnosed, which means that the people in each country, they don't really constitute a powerful tool in order to advocate and make things better in the country. By widening the base and diagnosing more people, it's going to help us a lot in pushing more for this international coalition.
Thank you for that. Let me now bring Matt in on this issue of the role of the global policy framework and how that would allow us to make progress. What's your perspective, Matt?
Tamsin, thank you. And from an APEC rare disease network perspective, the vision, the 2025 vision that we have is to facilitate greater alignment of domestic policies and regulations, to support urgent implementation of proven best practices, and to promote multi-sectoral collaborations and patient partnerships. That is the APEC Rare Disease Action Plan. I certainly encourage those to just Google APEC Rare Disease Action Plan, and that action plan will appear. And certainly, I guess, from an APEC perspective, we wish to accelerate and harmonize the design, adoption, and implementation of national rare disease policies and plans using the Rare Disease Action Plan as the guide to support local stakeholders. Now, when we think global, how do we do this globally? Well, I guess from an APEC context, we get to leverage existing supranational entities. APEC is a non-binding fora, and it's very diverse in terms of economic and income for each of the economies, in terms of over 15 different languages, different forms of government. And yet, in 2018, just a year and a half after we formed the Rare Disease Network, we got 21 governments signing off and endorsing this action plan. So if we can get our house in order, we're not representative of the whole global rare disease community, but certainly it is representative. It doesn't cover the whole global network. We can start to look and leverage. It is best practice. Durand mentioned that. Where does the expertise come from? Newborn screening, national newborn screening programs. Who's actually got that solved? Diagnostic pathways for rare diseases. That's not necessarily all in one particular economy, in a developed economy. As we find through APEC, there are developing economies that have actually got some of these initiatives and activities, in some ways resolved. We want to learn from that, so the pockets of excellence can occur in surprising places. So that collaboration becomes important. Bill talks about the public-private partnerships, and it's absolutely a delight for me to work with the industry coalition. The co-chair is Scott Williams from Sanofi Genzyme, and he's been a delight to work with, but he's representing not just Sanofi Genzyme. He takes a backseat from that perspective to look and support and ensure that Takeda, Genentech, Pfizer, Roche, Biogen are actually representative. And the excitement that we've had when we've talked to government and many governments in Korea, Vietnam, Thailand, and so forth, Australia, governments don't want to just talk to one industry partner. So we get to work as a coalition to understand that we need to work as a team. Yes, it is fiercely competitive, but certainly there are pre-competitive components that we need to be able to work together on. So I guess that's, the mindset. And if there's opportunities that we can share these experiences with the global community, then this is the opportunity that Jan has mentioned about how it could work and how we could actually start to build that global framework for rare diseases.
Thanks, Matt. Bill, let me invite you in on this. We've heard about the power of collaboration, both across the industry, with governments, connecting in with advocates. Durand has challenged us to get smarter about making the system changed. Where's your perspective about the value of some of these things that Jan said is a game changer, the UN resolution? How do you see a global framework making an impact?
Yeah, well, I think first of all, the panelists have had just an excellent perspective on it, and I agree. I think it is really, really important. It is a game changer if there is harmonization on this front. If your best definition is one or less than 1,000 people, and that's your definition of rare, I don't think that is quite enough to go with. And we've seen countries around the world treat it much differently. And rare suffers from this fragmentation. There's no one disease that can yell loud enough to be noticed. And by having those come together and really the power of 300 million citizens of the world suffering, that begins to have an impact when you start putting it together with the economic burden that it creates and just the terrible results for that population and for all of their respective friends and family. I believe that looking at it, we want to get to global definitions that will then allow the countries, and you have to understand the countries are at very different places around the world. Jan mentioned that at the beginning, to then be able to think about how do you from a regulatory format handle it and from an access format handle it. Now, we can also cover those things on a global basis as well, but I think having the countries have in their hands something which is consistent that they can act upon and then be able to share best practices. One of the things that's, very, I think, important is newborn screening. And we look across the world and it's just incredible the difference in newborn screening. I'll use an example like Taiwan, where in 1984, less than 7% of patients, of newborn, I should say, were screened. By 2014, it was 99.8% of babies. Now, that is something that took a long time, but with the force, with the will of the nation to do it, it can be done. And there are lots of things that we can do to begin to educate and share best practices across the world to really help this population.
Thank you. So you're making a call for global responses allows us to leverage the power of numbers. And if you add up around the world, the number of people with rare disease, 300 million is a significant number. I live and work in the European Union, and we're very proud of being one of the biggest trading blocs in the world. And we're around the 350 million population. So it's the equivalent of the EU population. And if you think about that, the importance we consider we have on the world stage, if we could accumulate all of the rare disease patients and then leverage that power, it becomes more visible, it becomes more attractive as a community to work with, and it becomes more logical to make a difference on that. So clearly, bringing the power of numbers will help us deal with this. So let's try and look forward 5 years from now. You've all on the panelists have talked about the change you've seen very recently in COVID, and for some of you, the perspective of the last 5, 10, or even longer for Durand, who's been fighting this fight for 30 years or so. If we could have a crystal ball, could move forward 5 years from now, currently 95% of rare diseases have no approved therapy. And yet the last 18 months have shown what we can achieve if we have industry researchers and policymakers with laser sharp focus, collaborating, being prepared to do things differently to achieve change. So if we could harness that same level of collaboration, Bill, what do you see the landscape for rare looking like in 5 years?
Well, it's very optimistic if we can harness that energy. I think that this community, more than any other, down to the individual, is incredibly motivated, and oftentimes it's just through necessity. You are diagnosed with a rare disease, your child is, and it requires you to be at the front of trying to advocate to find a solution. And many products and companies have been formed as a result of just a parent caring and wanting to save their child. So I believe this community, if any, can really have an impact on a global scale. What I see in 5 years from now is hopefully we have the definition, we have a pathway for for countries from both a regulatory and a better access plan in place, and we have more therapies. I believe that there will be more therapies. If you look at the pipelines of companies, they are very heavily focused on rare disease now. 30 years ago, there was one company at the time that was doing it. That was, Legacy Genzyme. And now a whole industry's been spawned as a result. And I think that is great news for patients, because innovation's ultimately going to get us there. But we can't forget that once you have the innovation, you have to find a way to bring it to patients, or innovation on the shelf does no good to anybody. We have to solve some of these big issues as a society. And I think that with the converging of good information now, and if we have, as Jan has talked about, a global effort, we understand now the potential cost associated with not doing something about rare diseases, and just a will by this group, I think we can make a lot of difference in 5 years.
Thank you. And I'm going to invite the people who are watching the live stream to share in their comments. What's your view? What we could achieve in 5 years? What difference could we make for the rare community if we were able to harness this energy, leverage the power of numbers, and all these things that we've talked about? Durand, let me invite you to look forward 5 years from now. What does it look like if we can leverage this power and harness the energy?
5 years from now, I don't know in terms of 5 years from now, but even 1 or 2 years from now, I think we could make a huge difference. The amazing thing about the rare disease community, and I'm listening to Assad and others talk about it, we don't compete with each other. There's no competition. It isn't like, okay, are we going to advance hemophilia, or we're going to advance SMA, or we're going to advance, cystic fibrosis. We recognize is what's good for one is good for all. We are all helping in terms of pulling each other ahead. I think that's a really important thing to recognize. And you don't get that everywhere. We don't even feel like we're in competition with chronic diseases. I don't feel like, we have to, cut back on cancer in order to advance rare diseases. No, what we're learning and what we're doing actually elevates us all. So I think that's really, really important. I think the other thing that's really important is if we take seriously Matt's talking about, what's thrilling for me in terms of APEC, and I've been proud to be the patient advisor into APEC over since it's put together the rare disease framework, is that they are economics. And what they're saying to us is that, again, it's, treating and diagnosing and dealing with rare diseases is not just a ethical and a humanitarian thing to do, it's an economic prerogative. And I think that's something I've been saying over and over again. So I think that's really important as well. I guess what it'll look like in 5 years really does depend on whether we work smart or not. Can we take advantage, of the possibilities? Listening to Bill talk about newborn screening. Do you know that one of the challenges in newborn screening is that each country, each small jurisdiction, even in Canada, each one of the provinces is doing it on their own? Not only is it inefficient, it actually doesn't work very well because you don't have enough expertise to actually be able to read a diagnostics well. So if we could work smart and say, somebody once said to me, we should have 2 newborn screening sites across Canada. That's it. And having 13 or 11 or however many we have is not only inefficient, it's actually dysfunctional. So can we get smarter? What about countries? What about sharing that information that comes out of newborn screening? We don't get enough in these very rare and ultra rare diseases to be able to actually make meaningful understanding in terms of how these diseases work. Again, can we do that? I think the rare diseases may be the most important thing that we can do, and how we can work in 5 years is, can we keep that cooperation going? We work with the companies, because they need us. They need our patients. They need us to find their patients. They need the patient groups to be able to do that. But we need them as well. And where we see the smartest movements for it is where there is that ultimate collaboration. we've also seen, I mean, I give Duchenne muscular dystrophy, you know, real hats off, because they figured out how do we gather all the patients together. Challenge for Duchenne is that there was all of a sudden so many companies that want to do, you know, treatments for Duchenne and gene therapies for Duchenne. They were running out of patients. And guess what? If you go into one clinical trial, you don't get a chance to go into another. And so patients were really confused. Where should I go? What should I do? And the community says, hey, we're a global community. Let us bring people together. Let us bring all the groups together. And there were hundreds of Duchenne groups. Let us work together and let us get you companies to line up with us. And we'll tell you which patients you can have. And we will help our patients sort out so that we get the best for you and for us. So I think it's, again, being able to work cooperatively, non-competitively, and to be able to take the best of all of us. So, you know, I don't think we've had a time yet to actually sit back. I almost want to take a 6-month hiatus and say, what are we learning? What would that 5-year future look like? I'm glad you asked the question. I don't know, because we haven't actually stopped long enough to figure out what is the most strategic path forward in order for us to take advantage of everything that we're learning. So I would love to have us do a global summit that does nothing but plan out the next 5 years in rare diseases.
Thank you for that, Durand. A suggestion that we'll put out into the space to see if it can get picked up, to have a proper planning perspective, a little bit of time to breathe and reflect and see where we go forward. Jan, I'm going to invite you to pick up on this idea of, you know, 5 years from now, if the stars are aligned correctly and we get everything moving, what more we could achieve. Just while you're thinking about that, I'm going to invite the audience who's watching us online to share your perspectives. 5 years from now, what could we achieve? What could be different for the rare disease patients where so few of them have diagnostics, have treatments, have access? So we've got 300 million people around the world. That's a big enough community to say, let's fix and let's solve some of the problems. People here who are watching us, I'm also interested in your views. Please signal to me if you'd like to make a comment or ask a question. I'll come to you in a second after Jan has a chance to give us his where we could be in 5 years message.
So I'm not going to answer your question. I'm not going to answer about 5 years, but about 10 years, not about the world, but about Europe.
Okay.
Is that, to that question I can answer.
That works.
Yeah. So what we did is that we did a foresight study with a consortium of academia over 2 years to look at the trends in the field of rare disease at the European and to some extent international level with 200 experts. We identified 12 major trends. Then we developed scenarios. The communities picked up the preferred scenario, invest for social justice, and then we developed recommendations. And that was the final. And that was developed thanks to 200 experts from all over Europe, plus a panel of young citizens, so the next generation, and also surveys to the patient community across Europe. So based on that now, we're calling for a European action plan on rare diseases. We want the parallel of the Europe's Beating Cancer Plan with a new ambition to really grasp on all the scientific and technological advances and to have a comprehensive approach, not to look at rare disease as health, but to look at it, as we were saying before in the UN resolution, SDGs, more broadly, a holistic approach, like Bill mentioned, but comprehensive, going from research to industry, to social, to digital, to health. It's all of that, and to reduce the equality gap. And our vision is that health and research are coming more and more together. The new knowledge about the disease, but also about the management of the care, needs to bring it together. And at the center, it's the data and the data analytics. So it's all about the digital transformation. And this is where we think our future is. And for that, all the new regulatory framework in Europe, the pharma review, but also the changes in the orphan drug regulation, all of that comes into that strategy, and to look at the ecosystem at large. And then all the conversation we had about investment and investment of society becomes another conversation, because it's not only about investing in the people affected by the rare disease, it's also investing into the science, because that new knowledge will be useful far beyond rare diseases. And also it's investing into the competitivity of Europe in the pharma and biotech industry so that it improves our trade balance by locating in Europe more of that innovation and more of that production and creating new value and high value jobs in Europe. So there is a bigger way to look at it. And it's not only the pharma, it's also the digital industry now, which becomes a major actor in that area, transform the health industry, but also brings new element itself. And in the middle of this, to go back to your previous question, is that there is two essentials in your view. Is that the innovation from the science and technology with the economic actor like the pharma and biotech companies is there. Somehow it's a huge, unique moment that we wouldn't even dream 20 years ago. But the problem is that we don't have that innovation into the decision-making process and all along the path to get it to the patients. Newborn screening, can you believe that cystic fibrosis is still not newborn screened in Sweden today? My daughter 30 years ago was screened in France. It takes 30 years to bring a progress just to the other side of Europe. In SMA, today, they are redoing the pilots in different countries. How stupid is that, as Durand is saying? It's the same thing. It's the same information. Why do we need to do it in Italy and in Germany and Sweden and France? Just work together. So the collaboration and how we go to decisions together, that's an essential. And another essential is the partnership. Partnership is one of the SDG, partnership. But it doesn't become real when we really discuss how to bring together the healthcare system and the companies to work on data collection, for instance. It seems that we need another pandemic and another revolution before we get there, when in fact it's a no-brainer. So that kind of new innovative partnership is also an essential in the next 5 or 10 years to succeed. And we need to transform that. If not, if we keep sitting in silos of policy and silos of actor, that will slow down the uptake of all this technological and scientific advantage to turn it into a social and health outcome for patients.
Thank you. Let me open this up to see if there's anyone in the room who wants to make a comment or a suggestion, ask a question to our panel. We're, I hope, making a compelling case that rare diseases, if you add it up globally, is a sufficiently large population that warrants investment, attention, political focus, and the advancements that we can make in science through rare, through focusing on the special, gives us much greater context for our health environment. Does anyone here want to ask a question or make a comment? And let's see if we also have anything from our online community. If not, I'm more than happy to keep asking questions of our panel, but this is the opportunity to bring in our audience. Do we have anything from the online environment? Yes. I'm going to invite a colleague, Anne-Sophie, is going to share some input from our online environment.
Thank you, Tasmin. This is not a question, this is a comment. And in fact, we've got several comments really, and the attendees are really encouraging the debate of today and acknowledge of the importance of the talk of today. And we see that they would like to go further with the world community, and I think this is really positive to hear that attendees are in favor of this discussion.
Thank you. That's good to know that we're resonating with our audience who's watching us, and hopefully, as being the World Health Summit, we're reaching a global audience. And the point we're making here is, if you accumulate the communities around the world, there is as we heard from the Duchenne, the patient communities can better allocate and align to this clinical trials. There's more sharing. We can avoid some of this waste and duplication that nobody has time for or resources for in rare, because it's urgent to find solutions. Let's perhaps spend our last 5 or 6 minutes looking forward a little bit more to see the developments that are happening in different areas. And I'm going to bring Matt back in on this. What have been the recent developments in your region? We heard about the national rare plans. We heard about your recent recommendations that countries are signing up to. It's sounding very positive. What more can we expect from your region?
Thank you, Tamsin, and certainly just to echo Dehane and Jan's comments, APEC lends itself to, I guess, promoting innovation to address ambitious issues. So the action plan, the Rare Disease Action Plan, is a 5-year plan, 2025, 70 recommendations. each with targets, with discrete action steps. So I guess in many respects, there are some, we really are quite ambitious, that we want to help and encourage and promote economies to be able to strengthen particular actions and particular recommendations from that action plan. In terms of, I guess, what are we seeing in terms of the developments? Earlier this year, we saw Chile really become a global role model in many ways when they launched a rare disease national plan development initiative with multi-stakeholder involvement, with the guidance from the Rare Disease Network and the action plan. The plan was then approved by the Senate, so it has political backing. In Malaysia, that continues to implement the rare disease framework that it had committed to a few years ago, but of course, COVID certainly had an impact in that context, as I mentioned, in terms of impacting the policymakers. And the Rare Disease Network is helping the Ministry of Health think about the rare disease list and the innovative funding mechanisms based on best practices from the region. China is another economy that is really sort of moving that needle on rare disease policy. And there's been a lot of sort of progress on the regulatory facilitation and harmonization side, including tax credits and tariff reductions. And also the National Health Commission has established an official office for coordinating rare disease treatment and diagnosis. And so we continue to work with China to share their approach with other APEC economies and to focus on finding and expanding the innovative reimbursement mechanism happening at the provincial level. Australia, the Rare Voices, RVA Rare Voices Australia has led an alliance of stakeholders in 2019 to develop a national strategic plan for rare diseases. And that was based upon the APEC action plan. And, we're sort of seeing and witnessing the change from government narrative in terms of the funding for rare cancers, rare diseases. It's just part and parcel now of funding models. I could continue, Tamsin, Peru, Mexico, Hong Kong, Thailand. There's so many exciting initiatives. And the key part about what we've brought together, and it's not any one individual, it's really that tripartite academia, government, industry. We have over 350 members from 18 member economies. 50% is representative by government, ministers of health and their rare disease entities, rare disease committees and commissions. Roughly about 30–35% is from an academic clinical perspective, advisors and experts to government, geneticists and pediatricians. And then 15% is membership is from the patient advocacy groups, and the Hain, and it is just a delight to have RDI a member of, I guess, of that leadership team. It's not disease specific, and I think that's really important to have that. I guess the umbrella organisations and federation. So what do we see going forward? Then we'll continue to identify champions from government, patient, clinical and academic communities, and equip them with the tools and opportunities to support in-market rare disease policy making and planning, and really that above-market knowledge sharing. And we want to spotlight in-market barriers and regional best practices. We've already heard about, Bill mentioned one of the APEC economies, Chinese Taipei, with their success in newborn screening. We want to sort of really just highlight and showcase that, but also highlight where the barriers are and see which other economy can help out. And that's really so important for coordinating regulatory approval pathways, HTA and funding mechanisms to improve access to orphan medical products. And then we really want to strengthen I guess the operations that drive growth within the APEC Rare Disease Network. And what do? We're going to have, we continue to have policy dialogue series. We want the expansion of strategic partnerships with Orphanet, and we've already started those conversations, and related partners, monitoring and evaluation of the action plan. So we sort of think about, of those 70 recommendations, sort of like a heat map of where economies are at each of the different stages, what the blockers, what the barriers are. And we want to encourage that participation for economies that perhaps haven't been strongly involved. As I said, 18 member economies, there's 21. So there are some economies that haven't yet strengthened. And of course, then how do we think about the Rare Disease Network? We're working globally in many respects, different time zones, different contexts. We're working with government. Not everyone's going to stay up at as it turns out, 1:30 a.m. in the morning here in Brisbane in Australia. We need to be sort of reflective and respectful that government involvement will need to be in those particular time zones. So can we think about nested communities and networks within the APEC Rare Disease Network that allow that sort of emergence of new leadership, relationships and collaborations within markets? So
Matt,
hopefully that gives you a sense of it.
Thanks so much. And I wasn't aware it was 1:30 in the morning for you, but thank you very much for being with us. And you're showing the true commitment of the rare disease community, because I know one of
Absolutely.
our panelists was awake at 3:30 this morning to be part of another online engagement. So clearly this is a community with energy and passion. And as we heard, non-competition. When there's an advance of one, it is celebrated and shared by others. So we've come to the end of our time, and I think it's been a fascinating conversation, incredibly valuable, and I hope everyone's had a chance to learn from it. And I think one of the key points that the COVID-19 message we should take away from it, the fact that we have a vaccine, the fact that we have intervention treatment, is because there was a long, slow, patient investment for a number of years on rare diseases that generated the technology that allowed us as a world to advance very quickly. So the message here, I think, is when you put together the 300 million people around the world who are living with a rare condition, this is a powerful motor for change. If it's recognized, if it's invested in, if it's allowed to take a leadership role and being a pilot in the collaboration, the engagement, the sharing, the alignment between patients, all of the things that we suddenly had to learn and made possible, like global recruitments into clinical trials very quickly, on offline sites for clinical trials, all these lessons that will be useful for the rare disease community because of the fragmented nature of it. So that as policymakers reflect on the last 18 months and try to draw out some of the learnings, I think the messages are clear for the rare community as well. But the added value it injected in to the world's response to COVID-19, perhaps this needs to be a return from COVID-19 response back to the rare community, which involves a prioritization, a recognition, and a pride of place in health system development. Because if we're going to make sure we leave no one behind, that means rare disease. And if we can advance the science, so we've got better diagnostics and treatments for rare, that's a benefit for everyone. So I'd like to conclude our panel on this, to thank all our panelists, both in person and online. So thank you to Matt and Asad online, to Durand, to Jan, and to Bill. Thank you for joining us. Hope to see you again. The plenary will be starting in a very short time. Thank you from the World Health Summit in Berlin, and goodbye.